Hey YouTube, thanks once again for tuning into our show, Morgellons disease discussion and microscopy videos. I'm your host, Jeremy Murphy, and today we have a very special guest with us, Dr. Eboni Cornish. She's a graduate from Brown University and completed her family medicine residency at Georgetown University. She was an apprentice in the laboratory of Francis Collins, the current director of NIH and leader of the Human Genome Project. Under his leadership, she analyzed genetic associations of chronic illnesses. Currently, she's a member of the American College for Advancement in Medicine, the Institute of Functional Medicine, and the International Lyme Disease Society. She is on the Physician Advisory Board of the Charles E. Holman Foundation for Morgellons disease. And thank you for being with us today, Dr. Cornish. How are you doing today?
I'm doing great, Jeremy. How are you?
Oh, better than I deserve. Can you tell us a little bit about yourself and how you came about to practice medicine?
Yeah, so I'm originally from Detroit, Michigan. Since birth, my mom said I've always thought outside of the box. So when I was looking to transition out of family practice, the job opportunity I applied for was for doctors who think outside the box. And my former partner at that time was the previous president of ILADS, and they were looking for a physician who was interested in integrative medicine as well as just, trying something new. And I said, why not? I've always been inquisitive. I've always been a researcher at heart. And so that's kind of how I got into the field where I am. It was kind of one of those things where I'm like, hey, let's explore. I like to find answers to things that aren't quite understood well. And I think I'm pretty creative. So that's why I'm here.
Nice. How has the focus of your profession progressed?
So I started treating chronic Lyme disease and tick-borne illness as well as fibromyalgia in 2011. And at that time, I would say my practice was very focused and tailored on formal antibiotic therapy. We wanted to treat the underlying disease. And over time, I've evolved into more of a functional medicine doctor or more of a detective, whereby I look at multiple different systems. It can be the gut, the environment, mold, heavy metals, diet, other toxins that you're exposed to, the psychiatric manifestations of disease, genetic predisposition of disease, and all of those and detoxification imbalances. I look at all of those things separately as I try to get a person back to wellness. So I do treat, chronic Lyme, chronic tick-borne illness, Morgellons, but I also say I'm a common sense doctor because I look at the entire patient and try to find out why it is that they're not feeling well.
Now, you are an expert in Morgellons disease, whereas you studied it, you've seen the research, and you treat several patients with the condition. What can you tell us about what causes Morgellons?
So I try to make sure my patients understand that what I do, I try to base as much as possible in the research. And that can be either the textbook, which is basic sciences, or published data. And what we know from the leadership of and the research of some of my mentors, Ginger Savely, and some of the other pioneers in the field, Raphael Stricker, Marianne Middleveen, is that our understanding currently is that the collagenous fibers produced in this Morgellons phenomenon, the etiology we think is either relapsing fever, borrelia. It's also been Bartonella found in the fibers, as well as H. pylori. So we definitely have found that there is an underlying infectious etiology to these Morgellons monofilaments. Clinically, anecdotally, I have found that a lot of my patients also have detoxification imbalances and high levels of inflammation. And that could be anywhere from, living in a mold exposure or mold ridden environment, or having yeast overgrowth, or heavy metal toxicity, none of which has been published to date, but a lot of that is just anecdotal data that I've seen most commonly an environmental component to this as well.
So you could say that many things contribute to Morgellons, or do many things cause Morgellons?
I think it's a combination of both. I think that when you're suffering from any type of illness in general, you know, maybe Morgellons, Lyme, fibromyalgia, anything, any terminology, you have contributing factors, which are the environment and genetics, and we also have causes, and causes can be an inflammatory burden. And I think it's essential for a physician to do their due diligence at evaluating both the contributing factors and what causes it. And that's what we're doing in our Morgellons population. Is we're publishing, trying to, number one, justify this disease. I know you've had Marianne on your show before, but number two, trying to understand what the cause is. I think the cause right now in the literature is showing that there's an infectious etiology, but I also think that there are other contributing factors that cause higher levels of inflammation that perpetuate disease. So it's important to look at both.
Now, what is toxic mold and what symptoms does that produce?
So toxic mold is also under the umbrella for systemic inflammatory response syndrome. There's a lot of research by a physician by the name of Richie Shoemaker, who is a specialist in both chronic Lyme and chronic mold. And he's published over 2 different research papers by which he's evaluated certain markers, biomarkers, which have been found to be abnormal in patients who suffer from the systemic inflammatory response syndrome, which is produced by mold or mycotoxins. There's also research by a physician by the name of Dr. Joseph Brewer, who looked at water-damaged buildings and the effects that those toxins or those mycotoxins in that environment have on a person, and they can cause symptoms like chronic fatigue or a leaky gut, inflammatory gut, and can cause cognitive impairment, compromised immunity, all right, inflammation, impairment of your adrenals. So it's a very long differential diagnosis, but it's important that you do your due diligence of evaluating any patient of whom has chronic illness for environmental mold toxicity, because it's a huge culprit in our population.
And when you're talking about water damaged buildings, that's about every city in America, isn't it?
Exactly. Especially with all the floods we've experienced in the last year alone.
Oh, man.
Yeah.
So it's kind of likely that somebody would have mold experience, but how likely is it really that someone would have Lyme exposure?
So, I mean, both of them are pretty common. So going back to the mold exposure, in general, you can have this exposure and be asymptomatic, or you can have genetic predispositions, and the markers that Dr. Shoemaker has published are certain HLA alleles, HLA-DR-DQ alleles. So those are genetics, polymorphisms, which are variants, that can let you know if they're expressed in a patient, if they're more likely to retain those mold toxins. Meaning, if this person A, is to go into that same exposure, instead of clearing the toxins like most people do, they hold on to them. And those toxins produce cytokines and increase your inflammatory burden. Now, transitioning to Lyme disease is very, very prevalent. I mean, Lyme disease has been around since the Iceman. And what we need to ask ourselves is, we know that we have a lot of exposure, but why is it that one person becomes susceptible and has a severe chronic clinical course versus someone else who may be asymptomatic? So I do think that Lyme, tick-borne illness, and when we say Lyme, that's an umbrella term for Lyme and different co-infections, Bartonella, Babesia, Ehrlichia, Rickettsia, and the list goes on. Relapsing fever, which has been shown in IGNX to be associated with Morgellons. But we want to find out, why is it that a person is still having persistent symptoms due to it.
So is borreliosis a different disease than Lyme and relapsing fever?
No. So you have a Lyme Borrelia complex, is the way I like to think about it. or Lyme as an umbrella term that encompasses multiple different infections. So Borrelia burgdorferi is what we traditionally think of as Beryllium, and that's the deer tick. We also know that there's a relapsing fever Borrelia, and that could be Borrelia abzeli, Borrelia miyamotoi. Those are other subspecies of Borrelia that are associated with relapsing fevers, and they can be found in ticks or in gnats. And the research showed that the relapsing fever species was found to be very common in Morgellons. Then you have Babesia, which is a parasite, but it's another tick-borne illness. It can be associated with sweats and headaches. All right. Bartonella, a tick-borne illness, which crosses into the blood-brain barrier and is usually associated with brain fog, pains on the soles of the feet, neuropathy. Ehrlichia, a tick-borne disease, and it's associated with liver dysfunction, liver impairment, also myalgias, arthralgias, and then mycoplasma pneumonia, which is associated with fibromyalgia and cough, as well as other types of joint pains and headaches. So a lot of these diseases under this Lyme Beryllium spectrum, they have symptoms that overlap with one another. We know that the test is not that sensitive these days. You know, they're really flawed. That's why a lot of people go misdiagnosed. But there are different infections and co-infections that can contribute to this Lyme Borrelia complex or tick-borne disease that we refer to.
So the research that we're discussing has consistently found Borrelia in Morgellons test subjects. But do we know how Borrelia produces the Morgellons fibers?
And that's something that we do not know the pathophysiology behind it yet. We know that there's a biofilm component to this. And I know from just pathophysiology, what happens is that you have active organisms which are in their planktonic state that become resistant over time. And these organisms develop what's called a microcolony. And that microcolony, because I like to make sure I say everything very simply, it allows for it to create this protective niche around all these different multiple organisms. And that's kind of the biofilm form. We know that there is a biofilm development in Morgellons, so a biofilm development, a form of this tick-borne illness. So I think that we are starting to believe that the biofilm component, the more resistant organism, is what's contributing to some of these clinical symptoms. But it's still to be determined.
So what other factors besides Borrelia would lead to skin fibrosis?
So that can be, like I was alluding to earlier, I think that the environment definitely has a lot to do. H. pylori, which is the bacteria that causes reflux, has also been cultured in the fibers by Eva Shappi's work in Morgellons patients, as well as Bartonella.
Okay. Now, you've done some work with hyperbolic chambers.
Yes.
What can you tell us about this? How are they effective at healing Lyme?
So hyperbaric oxygen is, I've been familiar in my previous practice with the utilization of a hard shell chamber. And what that does is that it provides oxygenation at very high intervals. That's 2.4, 3 times magnified than what you would get at room air. That can lead to wound healing. That can lead to the production of what's called glutathione, which is a natural detox, our free radical scavenger that goes around and removes all the toxins in the body. It can lead to the healing of your cells, give you energy. It also has some abilities to produce immune modulating, meaning it improves your immune system, okay? And depending on what level you go to, you start to have what's called antimicrobial effects, meaning it gives you the effects similar to that of antibiotics or herbals at the treatment of an underlying infection. Interesting enough, I had a chronic Lyme patient of mine that I had been treating since 2011, and she had actually had Morgellons, and I wasn't familiar with Morgellons at the time, and she did extremely well. You know, she was one of my patients who did well with hyperbarics. After she went through treatment, her lesions would worsen. And like I always knew, well, it does help with wound healing, but it wasn't until I really put it two and two together and said, oh, wow, it might be because of some of its antimicrobial benefits. I've had tons of patients with Morgellons do well without that hyperbaric or use other forms, not necessarily a hard cell chamber of hydrogen therapy, but I think that it definitely has shown to be beneficial in some of my patients.
How long does someone have to stay in the chamber?
So the optimal treatment for a chronic Lyme is going to a depth of about 2.4 atmospheric pressures under sea level for about an hour, 5 days a week for a month. So it's 20 sessions. That's where you get optimal benefit. Now, I haven't utilized hyperbaric therapy as often as I used to now because I have found that there are other supplements and other treatment modalities that I found as effective or, you know, work synergistically with HBOT. But if someone is using it, it's imperative that they understand that a hard shell hyperbaric chamber is the approach to use, not a soft shell, which is the one you can buy online. That's not as effective. It doesn't get you to the depth that you need in order for you to kill underlying infections.
Similar experience to the tanning bed?
No, I think it's not different mechanisms of actions, but infrared sauna that causes sweating is another very helpful detoxification strategy. It also provides a little bit of cardiovascular support. A lot of my patients with chronic Lyme and Morgellons do really well with infrared saunas.
Oh, wow. Several patients ask me about treatment protocols, and I always feel guilty telling them to go see a doctor, but because it's hard to find one a lot of times. But can't patients really hurt themselves trying different things out to treat themselves?
And that's an excellent question. And the answer to that is yes. I do empathize, especially with patients who are suffering from chronic illness. I mean, it's difficult to find a doctor. None of this is covered by insurance. You know, it's expensive. You've been disregarded by a lot of the doctors in your network. And so there does become a sense of desperation. However, there are a lot of risks. You know, time and time again, I see patients who've tried to self diagnose and treat or whatever disease they're suffering for or illness. And it can be really dangerous. And that's why the majority of supplements on the market, they tell you that it should be under the advice and the consult with your physician because there are a lot of side effects, especially if you're treating an infection like chronic Lyme or tick-borne illness or Morgellons. You can have severe what's called Herxheimer response, which is just basically your body responding to dead organisms or die-off reaction and a high inflammation that's produced. And you can have a lot of adverse reactions to it. So I understand. And like I say, I empathize because I know it is hard to find treatment, but it is very dangerous. And you can have a lot of adverse outcomes from self-diagnosing and self-treatment, unfortunately.
It's always good to have a good doctor on your team.
Yeah, it is. It is. Or someone, even if they're not on your team, someone who's supporting you through this.
Exactly. Now, what is the ILADS organization?
So, International Lyme and Associated Diseases Society, which is ILADS.org, it's a group of non-disciplinary physicians from around the world that know and understand that chronic Lyme and tick-borne illness does exist. We also know that this is a disease that you treat clinically because the tests are flawed. So we're different from the IDSA, which is the Infectious Disease Society of America, or the Center for Disease Control, because we know that chronic Lyme does exist. Excuse me. That it does exist and that you have to treat clinically, meaning you have to sit back and you have to utilize your clinical judgment, be a doctor, and understand that tests can be flawed. And so that's what we do. And we go around. I'm actually on the Educational Foundation Board of ILADS this year. And one of the things I'm going to be working on is training programs for doctors. For the last few years, myself and Ginger Savely, we've actually trained doctors as a part of our Fundamentals ILADS training course on how to treat chronic tick-borne illness. So we spread education and awareness. We advocate and we treat patients based on a clinical diagnosis.
That's commendable efforts.
Thank you.
If someone wants to know, because there's a lot of information out there, regardless if it's true or false about Morgellons. In my experience, most of the information, at least on YouTube, seems to be false. But if someone wants to know about Morgellons from an unbiased and scientifically credible source, who would you recommend they look at, read, or check out?
I would definitely recommend the Charles E. Holman Foundation. You know, Cindy Casey and their staff has done an excellent, excellent job at providing the tools you need to make informed decisions and also providing guidance. Ginger Savely's book on Morgellons is amazing. It gives you an overview of this disease and her clinical experience with treatment of the thousands of Morgellons patients that she's had in her office. And those are both unbiased websites. And they're based in deeply rooted in evidence by people who've been doing this for quite some time.
Commendable. Now, let's shift gears slightly for just a minute here. I'd like to talk about, since it's flu season, vaccination. From what I understand, some people can become severely disabled or hurt after vaccination. But is there any way to determine that before they go in and try to get the flu shot?
And that's an excellent question. And there's really no way to determine that. I'm always telling my patients to be cautious with vaccinations. I'm not, I'm not anti-vaccinations per se, because I do think that there can be some benefits. But in the immunocompromised patient, I have seen anecdotally exposure to vaccinations just because of the fact that they are either live attenuated or live organisms or dead vaccines, that if your immune system is low, you can react to it and you can become inflamed by it. But that's on a case-by-case basis. I would say if someone is considering vaccinations, that they really do need to discuss it with their provider, look at the risk and benefits if they're someone who suffers from an immunocompromised disease, and make the best decision that's suitable to your needs.
Now, what about GMOs? I see people saying there's nothing wrong with them, and I see people saying that they're soaked in pesticides. Are those good or bad for us?
Yeah, GMOs are awful. There's actually new research that shows that Roundup actually alters the genetics of the gut bacteria in the rat model. So we know that it definitely has an adverse effect on the gut bacteria. And since 70% of your immune cells are produced in your gut, you can only imagine what will happen if you're ingesting something that can cause an adverse response to your gut bacteria. So I definitely think that the utilization of Roundup, pesticides, gluten, a lot of those toxic chemicals that are in our foods are really destroying our population. I think they're very hazardous. But we are exposed to it all the time. So you just have to use your judgment. I can't tell everyone, go out and be GMO free, gluten, dairy, blah, blah, free. You have to do what's in your frame of reference, but just understand that those are toxins that are definitely harmful, and there are tests for them.
But how do they end up in the food supply? Pesticides aren't supposed to be a part of the food, are they?
Yeah. And I mean, pesticides are in the soils, when they're in farms, so they're actually grown in soils. And when the animals eat the soils, they're going to be exposed to the pesticides. And I'm always one of those firm believers that how organic can you really be if the fact that everything is coming from the soils? When I test some of my patients for NutriVals, which is a nutritional assessment, I look at their pesticide levels. I look at what's called MTBE, which you get from gasoline derivatives, which are found in pesticides, which a lot of times are high. When we're all exposed to them on a daily basis, no matter how pure it is we try to eat, unless we're eating air and rocks, we all have some sorts of exposure. I always tell patients you try to limit as much as possible, and also try to make sure you do your own types of fasting. I recommend fasting every 4 months, but guided fast. I don't say like do water fast or juice fast. I think that fast should be done under the guidance of a health professional. And the one I usually recommend my patients to do is just a fruits and vegetables fast. When you eliminate all the different meats and all the different glutens and sugars, and just really allow your liver to purge and increase your body, that glutathione I mentioned earlier, to open up that liver. So like I said, we're all exposed to them. No matter how pure it is, we try to diet. But we just have to do our best at improving our body's ability to detox.
Well, and as well as eating, what we breathe also has an impact on our health, right?
Correct. Definitely. And that goes back to what we were saying about, mold being in the air, people retaining those mold toxins, and just the pollution that exists right now. We're all just right now we're inhaling toxins, and that just goes back to how does your body deal with them? Are you a person that's able to clear them, or do you retain them? And that's kind of one of the big focuses in my practice is really strengthening detoxification abilities.
So if someone feels sick or weak when they have like advisories on the news about environmental impacts, they can actually get help for that and kind of reverse the condition.
Oh, yeah, definitely. It's all about going and, like you were saying earlier, the causative factors and the contributing factors. And when it comes to the environment, having someone do their due diligence at looking at your home, the air you breathe, the water you're drinking, the food you're eating. I typically test patients for all of those things. I'll test for mold. I'll test for heavy metals. I'll test you for your nutritional status. I'll test your inflammatory markers, just to get that baseline assessment of how your levels of toxicity is impacting your clinical course. So all those things can be treated. Even with mold toxicity, it can be remediated. You can bind toxins out your body. You can strengthen your liver's ability to clear them. But the big thing is to find out if they're present and how to limit your exposure.
What about water? Should we be filtering our water coming in from the city? We hear all the time here that Greenville has the cleanest water in the country.
Yeah, I do recommend filtering water. I definitely think that that's a good thing to do. And if you are concerned, to have your water tested. I've had patients of mine who've shown up positive for lead or arsenic, and they have, oh, my water is filtered completely, but then they have lead, mercury, and arsenic in their water, even though they're not drinking it, they're bathing in it, they're showering in it. So, if you think that is a problem for you, it's so easy to have your local authorities test your water, and it's inexpensive.
We're getting down to the last few questions of our interview, and I definitely want to thank you again for making time to be here with us today and answer these questions and give us your perspective on Morgellons disease. Where do you live at? Are you up there in DC?
Yeah, so I work in Leesburg, Virginia, which is about an hour or so from DC. So I'm in the northern DC, Virginia area, what we call it, the DMV. That's what they call it.
What's it like up there? Is it hectic?
It is. It's cold right now. It's pretty hectic, but in our area, Loudoun County, which is where I practice, it's the Lyme capital of the world. We have some of the highest rates of Lyme disease in the country. I was very surprised when I moved here. So even when I was finding my own home, one of my questions to neighbors was, hey, have you seen deer? How many deer are in this neighborhood? So it's one of those things because it is endemic all around the country, but especially in my neck of the woods.
Now, you're really working hard and making a lot of achievements and accomplishments with your current career, but have you thought about what you'd like to do outside of being a physician?
Outside of being a physician, I love being a mommy. So I have triplets. They're 16 months. You might hear them. I'm always imagining myself being on an interview and one of my kids running in here, you know, because they're walking now and just interrupting. I think that newscaster, when I saw that, it was a newscaster who had that happen. This child ran in and on the interview with them. I thought that was hilarious. But I just love being a mom. I'm a nerd. Yeah, I love to read. I love being a mommy. So getting to work from home, spending time with my kids, watching them grow up. That's just the best thing to me. And I do a mean karaoke. I can't sing. That's why I said karaoke, but I'm pretty good at that.
Commendable.
Yeah.
Dr. Cornish, thank you for making time again to be with us today. If you would like to check out more of Dr. Cornish's efforts, I would recommend going to the Charles E. Holman Foundation website, thecehf.org. And if I'm not mistaken, you are making appearances on the conference DVDs, which can be ordered on that website, correct?
That is correct.
Okay. Dr. Cornish, thank you for your time. If you guys like this video, be sure to hit like, subscribe, leave a comment down below, and we'll be talking to you again soon.
All right.